Well, the flu season has just started really in Ohio. We're seeing a little bit of flu activity, but not a lot. But we don't know when it's really going to kick in, so we really want to encourage everyone who hasn't gotten a flu vaccination to go get one right now. There should be plenty of flu vaccine out there, and we want to make sure that people are aware that now's the time to get the flu shot if they haven't gotten one. Well, flu is unpredictable, and we really don't know what this season's going to hold for us. Last year, we did have a very early season. This year, right now, we're having just a little bit of activity with flu viruses circulating, but not a lot. But it's a time then to give people time to get their flu vaccinations before we really start seeing a lot of flu circulating. The flu vaccines cover a couple of different strains, because usually, actually, in a given season, multiple strains will circulate through the population. So the good news is the vaccine will cover all of the ones that we think will be circulating. It'll cover a B virus and then a couple of different A viruses. We recommend that everyone 6 months of age or older be vaccinated against the flu, but in particular the high-risk individuals, and that would be young children, older adults, individuals with chronic medical conditions like asthma, diabetes, or heart disease, pregnant women, and then anyone who's in contact with those individuals, either by working with them or living with them, should also be vaccinated to make sure that they can protect those people. So not only do you protect yourself from getting the flu, and that's the best way to protect yourself from getting the flu is to get the flu vaccination, but you help protect those in the community who can't be vaccinated, such as very young infants, and then others with medical conditions that maybe prevent them from getting vaccinated or from getting a big immune response. So by getting a vaccination, you protect the entire community. We'd like people to be getting vaccinated now if they haven't already gotten their flu vaccine. There's plenty in the community, and we would urge people to seek out a flu vaccine near them. There are a lot of different places that have flu vaccine. There's pharmacies, some of the grocery stores that have pharmacies in them, local health departments, and your physician. So you may want to start by calling your physician's office and then go from there. So there's lots of different types of vaccines actually that are available this year. We have the traditional flu shot. There's also the nasal spray, which is for individuals 2 to 49 years of age that are healthy and not pregnant. There is an intradermal shot, which is a really small needle for people that don't like needles. And then for older individuals, there's a high-dose flu vaccine available. All of the vaccines provide protection against influenza, so we would tell individuals that the most important thing is to get vaccinated and not so much worry about the type of vaccine that they're getting. The side effects may be a little bit different. The flu shot may cause a little bit of a sore arm in some people, and some people get a little bit of a stuffy nose if they get the nasal spray. How well the vaccine works depends a bit on both the viruses that circulate in a season and whether or not the vaccine that was made matches well to them, as well as the individual getting vaccinated. Each individual's immune response to the vaccine can be better or worse in regards to how it responds. So it's hard to tell exactly, but we definitely know that getting a flu vaccination is the best way to protect yourself from getting influenza. A lot of people are concerned about possible side effects from getting a flu shot. The side effects that we really see are just a sore arm from the shot or maybe a stuffy or runny nose from getting the spray. You can't get the flu from getting a flu vaccination. The only thing I'd like to encourage is that people have more questions or would like more information, they can visit our website, or they can go visit their local health department website or call their local health department for more information.